Hi, I'm Dr. William Rossy. I'm an orthopedic sports medicine specialist who is fellowship trained and has a specific interest in hip arthroscopy. I'm a member of the medical staff of Penn Medicine, Princeton Health. Today, I'm going to talk about hip arthroscopy, also sometimes referred to as hip scopes, and how these procedures can be used to address certain hip injuries and return patients back to their previous activity level. While doing this, they can also minimize the risk of future arthritis of the hip. Hip joint injuries can occur from either a sudden acute injury, usually the result of a sport injury or an accident, or on a more chronic basis from normal wear and tear that occurs over several years. Regardless of the mechanism, these injuries can cause significant discomfort and limit a patient's activities. Typically, a physical exam and imaging such as an MRI or X-ray is used to determine whether or not a patient is a candidate for hip arthroscopy. If the joint is otherwise healthy with no signs of hip arthritis, hip scopes can typically be utilized to help this patient return to their previous activity level. A hip scope is a minimally invasive outpatient procedure where a surgeon can use a fiber optic camera to address certain issues in the joint that are causing pain. The hip arthroscopy typically takes anywhere from an hour and a half to 2 hours. It's an outpatient procedure. The patient goes home the same day. However, the time of the surgery can vary depending on what is performed. It can also be used to address hip impingement such as cam-type deformities or pincer deformities, remove fragments of cartilage which are loose in the joint, or remove inflamed or diseased joint tissue. It can also be used to shave down bone spurs. The hip scope itself causes very little trauma to the joint because it utilizes little incisions, which generally means the patient can recover faster with less post-operative pain. Hip scopes are typically done on young athletes who injure their hips playing sports. It can also sometimes be used to help the older active patient who has no associated arthritis but has chronic hip pain from previous injuries. Recovery from hip arthroscopy depends on the actual procedure being performed and the condition being treated at the time of surgery. It often includes limited or no weight bearing for a short period of time, as well as physical therapy. A course of regimented physical therapy really is crucial in order to return patients back to their previous activity level and optimize their overall outcome. Physical therapy also has been shown to reduce the chance of scar tissue developing, which only further helps the patient recover. So, for patients who have suffered a hip injury and prefer a minimally invasive approach to treatment, a hip scope offers all the benefits of a traditional open surgical procedure with a much less painful and shorter recovery. It has a more reliable return to sport and other activities, as well as a lower risk of future hip arthritis.